Opening the back table pack. The back table is used for storage of sterile items before and during the surgical procedure. The back table pack is the first item that you will open when establishing the sterile field. You will work from the center to the periphery of the sterile field so that your movement around the back table will not compromise the sterility of the remainder of the field. The back table pack should be centered on the back table. Plan carefully because once open, the wrapper may not be relocated. Back table packs are manufactured by several different companies, and not all styles will open the same way. If the pack used at your clinical site is different from the one used in this demonstration, please read the instructions printed on the wrapper and/or ask your preceptor for guidance. Tape securing the wrapper edges is torn rather than removed. The wrapper is opened using sterile technique, and the wrapper edges, called flaps, are opened sequentially, opening the flap on top first. Before opening the wrapper, ensure that a minimum of 12 inches of space is available between the back table and the wall, other furniture, and yourself. The first flap of the wrapper is opened away from you by touching only the outer surface of the wrapper. Use caution not to reach or lean over the exposed sterile portion of the partially unfolded wrapper. The second flap of the wrapper is opened toward you by touching only the outer surface of the wrapper. Use caution not to reach or lean over the exposed sterile portion of the partially unfolded wrapper. Remove any accessory items, such as the separately packaged gown, if included. Place the gown on the Mayo stand. You will open it later. The flap with the raw edge folded back towards the lateral edge of the back table that is on the top is opened first. Maintain at least 12 inches of space from the partially opened wrapper and move to the appropriate end of the table. Stand at the end of the table, grasp no more than 2 inches of the edge of the wrapper and pull, but do not lift, the wrapper edge towards the edge of the table, making sure that it lies flat on the table but that the wrapper does not move. As you finish opening the wrapper edge, squat down or tilt your body to the side to avoid leaning over the sterile field. Let go of the drape and let the edges fall towards the floor. Keep your hands at your sides, face the sterile field, maintain at least 12 inches of space between your body and the back table, and move to the opposite end of the table. Repeat the same movements for this side of the wrapper that you just used on the contralateral side. Stand at the end of the table, grasp no more than 2 inches of the edge of the wrapper and pull, but do not lift, the wrapper edge toward the edge of the table, making sure that it lies flat on the table but that the wrapper does not move. As you finish opening the wrapper edge, squat down or tilt your body to the side to avoid leaning over the sterile field. Let go of the drape and let the edges fall towards the floor. Always maintain a distance of 12 inches or more from any sterile item. Only the draped top surface of the back table is considered sterile. Anything that extends beyond or below the table surface is considered non-sterile. Open the item positioned next to the back table near where you're standing. In this situation, if you're on the left side of the table, open the basin set, and if you're on the right side of the table, open your gown. Remember to keep your hands at your sides, to face the sterile field, and to maintain a minimum of 12 inches from all sterile areas.